HealingYourself.Life provides information for awareness, educational, and support purposes only and does not diagnose or prescribe treatment for any medical condition. Viewers are encouraged to do their own due diligence and consult with their own medical caregivers before making personal treatment decisions. Welcome back, everyone, to HealingYourself.Life. We are once again with our retired FDA researcher and also off-grid Dr. Jane Nielsen M.D. We're going to talk about hormones, the challenges of why hormones are such a concern in today's world, how they affect both men and women when they are out of line, and what you can do to bring yourself back into hormonal balance naturally and safely. Dr. Nielsen, thank you for joining us again here on HealingYourself.Life.
I'm glad to be here. Love doing it.
This was actually instigated by one of our viewers who's been asking us to talk to you about how people can restore healthy hormone levels that have gotten out of line for whatever reason and do it in a way that's not going to bring additional risks into their life. So could you talk to us first of all about why hormone levels are so important? What are they, both for men and women?
Well, it's worth reviewing all of the hormones because it gives you a quick picture. Basically, hormones are on switches, and each hormone has its individual purpose. Testosterone is what makes you male, and it's also the hormone of repair in both sexes. Estrogen is what allows you to be pregnant, which is why women have a menstrual cycle and spend 2 weeks getting ready for pregnancy, and then, oh, I'm not pregnant, menstrual cycle, whereas dogs are in estrus, they wait until they get fertilized and then they start. And so estrogen is all the hormone of making tumors. And of course, most popular tumor on the planet is pregnancy. And it does that to the woman at the expense of the mother to protect the baby, which is why some women just get racked out by pregnancy. It's really hard on them, and why it causes weight gain. But especially, you then need progesterone, because progesterone is the hormone that stops the risk of cancer from growth and keeps it biologically normal. And that's the reason why hormone replacement has to be human estrogen with human progesterone and not fake progesterone and not Premarin horse piss. So that's your sex hormones. Then you have your adrenal hormones. And cortisol is the body's natural anti-inflammatory. And epinephrine is the fight or flight hormone. And DHEA is the anti-cancer and bone repair hormone. Those are all made by the adrenal gland. Then you have thyroid hormones. Endocrinologists don't seem to know anything about thyroid. They keep giving people T4. T4 is a storage form. If it doesn't turn into T3, it won't go to the cell. If it doesn't cross into the cell, it won't turn into T2, which is the active form, which can't be measured. And so what thyroid is the on switch to all activity. If you don't have thyroid, you're not moving forward. So those are really kind of there are more hormones out there, but we'll kind of quit there. And then you have your modulators. So you've got the cortex of the brain telling the hypothalamus to make hormones that look to the pituitary. Then you have pituitary hormones that then are the thermostat for controlling the end organ hormones. So you have thyroid releasing factor from the hypothalamus causing thyroid stimulating hormone in the pituitary, which is making the thyroid put out thyroid hormone. Then the presence of that thyroid hormone sends a message back through that loop and shuts it down. So it's a negative feedback loop. And that's how the body does its endocrinology. And we make lots of our diagnoses from elevations in pituitary hormones, which means that the brain is telling the body, I don't have enough of this. Okay?
So let me just jump in, because this was maybe common sense to you, but that was a really complex picture but basically what I got from that is that the brain initiates and controls the request for this cascade of hormones from
That's why in medical school we study neuroendocrinology. We don't bother to separate neurology from endocrinology because you can't. You know, it's really fascinating stuff. And then we have one more, which is parathyroid hormone, and that's what controls vitamin D and controls bone health, and it's a huge anti-cancer issue. And so those are the big ones. There are thousands of hormones in the body, but those are the big ones. And our purpose today is really to talk about the estrogen, progesterone, DHEA issue, and then in men, the testosterone issue. And we will completely leave thyroid and cortisol and adrenal issues and parathyroid hormone alone.
All right.
Because we haven't got a chance of covering what we're going to try and cover.
We'll circle back with those another time. And when we're talking about men, I don't know if it's fair or for women too to talk about what stress does to hormone levels. And you mentioned cortisol in passing, and maybe that'll come up again.
I think it's the other way around. I think the lack of hormone levels causes stress.
All right.
I mean, we hear that on the ads on the radio. So you hit menopause and you're getting belly fat because your cortisol's going up. The stress of menopause makes your cortisol go up and you gain weight and become diabetic. Okay? And so it's actually flipped from that. It's less, it's kind of hard to control except for putting out a little epinephrine or cortisol on a spurt because you're upset. Really, your endocrinology is going to crank along. It assumes you're going to get upset, and its job is just to keep building bone or, keeping you pregnant or whatever's going on. It's the other way around. So your question was a great opening question, and that is, how the heck did this get so messed up? Okay? And 2 weeks ago, this article was in my inbox that sperm counts are falling all over the world. Okay? And why would that be? Might that possibly be our old friend, the plastic water bottle, and the massive increase in soy that's going on? And of course, that all becomes real personal when you go to, and phytoestrogens, the plasticizers, okay, are the reason that we used to have almost no breast cancer in this country. When I came out of medical school, breast cancer was the 11th most common cancer in women, and now it's number 1. Oh, come on. Well, I can't be right.
This is something that just blows my mind. Is like we live in a supposedly rational world where we're all supposedly educated and intelligent and everything, and yet the response to rampant increase in breast cancer is, oh, let's go do a race for the cure and do this elaborate research and everything. And it's like,
raise money for abortion. But most people don't even know that Koyman for the cure is a front for raising money for Planned Parenthood.
And that has its own implications of risks to the mother long term.
Yeah, well, absolutely.
But if it's not a communicable disease and it's on the increase, what's changing? What's driving this increase?
They don't want to know that. They're just happy it is because it's good for the medical economy. Cancer's a big money maker. I mean, you just look at the price of chemotherapy drugs in Europe is 10 cents on the dollar to America. How can you miss? You make something for $500 and you sell it for $5,000 a dose. What could possibly go wrong? That's just a train wreck, and the whole. You just got to get your tinfoil hat out in order to begin to understand all of the socioeconomic pressures that are on healthcare. I just, heard one of the senators on the news today saying we're doing something very wrong. America is number 17 in quality and approval of the healthcare they get, and number 1 in cost. And France, which is number 1 in approval and quality, is 17th in cost. We're doing something wrong, And I know what we're doing wrong. We don't have any competition. We're running a monopoly. We have 3 insurance companies that all now. We used to have 50, and now after Obamacare, we got 3.
So what kind of, and we're going to touch on that more. We did a little bit of the financial aspects of the medical system in an earlier talk with you, and we want to circle back on that. For women in particular, what are the most common problems that occur in today's world with hormones? Well,
the biggest problem that you have is that, and I want to give people a chart to see this, because this is hard to imagine, and I've got a couple charts I want to show. Okay, this is what happens to your estrogen and progesterone in your life. You start out with no hormones because you're pre-menarche, age 13, and then you're really good at making hormones, so you make too much estrogen, you get heavy periods, and you have PMS, and then you have your first pregnancy, and you spike your estrogen progesterone, and after your first period, your PMS gets less for the rest of your life until you start to approach menopause, and then your progesterone goes down, your estrogen goes up, and you get breast cancer and PMS again, and then you hit menopause, you lose your hormones, and then you get all the diseases of menopause. This is a life cycle, and I have women who come in all the time and they say it's natural, and I go, I completely agree that menopause is natural. So are cataracts and aortic rupture and macular degeneration and worn out hips. They're all natural. What's natural is that we were supposed to be dead by about 38 for a long, long time. And now all of a sudden in the last 100 years, we've taken our lifespan from 40 to 85 to 90, and we're surprised that we have some organs in our body that were designed to make us to the end of our life. There wasn't any, this isn't failed engineering, this is perfect engineering. You don't see very many people who are 45 years old who are in bad health unless they're eating carbs like crazy. They're in pretty good shape, or they're infected or sick or something. But in terms of being worn out, except for a few football players, really, honestly, this body performs at an extremely high level. And then really starting at about 50, we start to break down. And the men do that slowly because they lose a part of their hormones, and the women do it very abruptly because their ovary dies with the last egg being made, and they precipitously go to no hormones, and 0 hormones is a big difference from 10% of your hormones. And as a result, they just start falling apart. And that's the reason why women have a much lower risk of heart disease until menopause, and then they pass men by the time they're 75. And so, the whole natural thing's nuts. It's just, and I just look at people and go, you're right, it is natural. It doesn't matter, it's still killing you. You still got to deal with it, or you got to decide I'm natural, I want to be dead.
So something you just touched on women's heart disease. We've been told for the past few decades that the working theory, the operative theory was that the reason that they're seeing more women's dying of heart disease, or women suffering from serious heart disease, was that women entering the workforce, living a more different kind of stress than they're used to, or what they're designed for, or whatever.
More smoking. That was one of them that was a variable. But the plain fact is that if you look at the micro numbers in between, you have to remember that when I came out of medical school, we were supposed to fix women's hormones with Premarin, horse piss, and Provera, fake progesterone. And that product was universally prescribed to women who complained of anything: sleep disturbance, depression, fatigue, hot flashes, skin breakdown, vaginal atrophy, all of the symptoms of menopause. You treated that. And then we had this scare where we decided that horse piss was a bad idea, and it is, and we recognized that it caused cancer. And so subsequently, we then stopped doing any hormones, and we watched heart disease go up very quickly. And so we actually had if you look at decade by decade, we see a completely different incidence of heart disease. And I have some statistics in here today that I'll show you that now that we're not treating hormones, and gynecologists don't believe in fixing hormones, the incidence of sleep disturbance in women is going through the ceiling. And there's some really fascinating stuff here. Look at this one. Menopause causes a 800% increase in risk of sleep apnea. Go ahead, go to your sleep lab and have them diagnose you with sleep apnea and see if they even so much as think about menopause. That is the largest risk factor for any disease I have ever seen in my life, except for gunshot wounds and the ratio of that being fatal. That is the most dangerous thing I've ever seen, is the rate of sleep apnea from menopause. And this was just published just a couple years ago, going that the fact that the rate at which we're giving hormone replacement in this country seems to be directly related to the rate at which we're using sleeping pills, which is really fascinating. And so the whole problem is this medicine doesn't think biochemically. Doctors don't know any biochemistry. We're not taught any we have it in medical school, but we all go, man, I can't wait for this class to end. The same way they feel about pharmacology. I loved pharmacology, but most doctors don't. And they just go, I'm just going to write whatever the drug rep gets me 2 free pizzas for. That's how American medicine works. And so, we need to get back to the fact that it's always back to the Paleolithic man question. We always end up going, you wake up every morning and your body still thinks that you're a hunter-gatherer living in the back of the cave, having a seasonal diet and a seasonal sun cycle in your face. And every time that we have a problem, you can trace it back to the fact that we've left that lifestyle, okay? And so here's one of them that is simply we've outlived our ovary.
All right.
Okay, and so now we go, well, it's okay, it's natural. Well, no, it isn't. You look at all of the things that are here. Oophorectomy, removal of the ovaries, is related to dementia, Alzheimer's. Okay, the cause of Alzheimer's we have 13 published studies showing that Alzheimer's is caused by menopause. 13 studies. And yet, and I'm going to put some of them up. This is a new one since my 13 studies. This is a study showing that if you fix your hormones, that they can show that your dementia goes away. And they did it in clinical testing.
That's a big deal.
This is just about 2 months ago, okay? And then you got the issue, what's the rate of depression in the United States? How do you separate depression from menopause? I go to a conference at Old Opry every 2 years with my wife for the American Association of Christian Counselors. And I could talk about that conference forever. It's a great conference. I really love it. But the director of the conference has asked me to start teaching a half-day conference there, because what I do in practice here in this building is I have 4 or 5 counselors that work with me. And they're all seeing people who come in and say, I'm anxious, I'm depressed,
can't sleep, whatever.
Can't, all of the problems that bring people into counselors. And my counselors are all trained to recognize the difference between an emotional disorder and a medical disorder. So then they refer those people to me. And then I make sure that I can't fix their problems medically before we send them back to the counselor, so that their counseling can be optimal, short, and effective. And but this relationship has given me a tremendous amount of experience in managing emotional disorders from toxicology, endocrinology, etc. And so, these concepts where menopause causes depression, try telling that to a gynecologist. He's not going to buy it, okay? Here's another one. Depression doubles at menopause, okay? And the reason that this has happened is because we started out, Premarin was invented in, I think, 1915, because all it is just dehydrated pregnant horse urine, okay? Premarin is pregnant mare's urine. Pregnant mare's urine, Premarin, okay?
Okay.
That's where it came from. It used to say in the PDR, may cause uriniferous breath, meaning that they did such a bad job of removing the urine that you could smell it on women's breath, okay? And about 20 years ago, they took that out of the PDR. They didn't take the urine out of the product, but they did take the warning out of the PDR,
oh my
okay?
God.
And then the problem is they need something they can patent, and then they got to keep making it new. So first we had Premarin, and then we added Prevera, okay? And then we rename it and change the milligrams, and we keep, so the pharmaceutical companies can keep having brand name high dollar stuff plus their generic Chinese crap, okay? And so all of that ended. And when I started doing bioidentical hormones in 1981, and the only reason I learned about them is it just so happened that my personal pharmacist, where I filled my scripts, was the only compounding pharmacist in Ohio. He was in Sandusky, Ohio. And he taught me about bioidentical hormones. And the minute I heard about them, I went, really, there are human hormones? I didn't know, they didn't tell me this in medical school. He said, oh no, they're not going to tell you that in medical school. And the minute that I took all my women off of Premarin and Prevera and put them on bioidentical estrogen and progesterone, they went, oh, this is much better. And so and immediately all the gynecologists reported me to the state medical board, and I got put on trial for doing the right thing. When I did that in 1981, except for this guy in Sandusky, the only other place I could get hormones was in Wisconsin, where it was legal. And it was technically illegal in Ohio, which is really crazy. Within 15 years, there were 30 compounding pharmacists in Ohio. And, now bioidentical hormones is very, very common in people. And that credit has to go to Suzanne Summers. Suzanne Summers just absolutely, had to carry at least half the weight of getting people to recognize the importance of fixing hormones. And she has spent the rest of her life talking about it. She's a great speaker. And she was a keynote speaker at a meeting I went to a few years ago. I was very, very impressed with her ability. She sounds like a physician when she talks. And so the problem that we've run into is that the FDA standard for putting a drug in the PDR is that you have to do $300 million worth of research on each component. So I've got estriol, estrone, estradiol, progesterone, DHEA, testosterone, pregnenolone. So I'm looking, I didn't do the math, but $1.5 billion? Well, who's going to pay that? My custom compounding pharmacist who's working late at night in the back of his pharmacy? Maybe Jay will do it. There's nothing. There's no way for that research to be done. So the FDA does the we got you, and makes it all off-label, special. And of course, there's rules about custom compounding. I can tell a pharmacist to make anything on an individual basis. What I can't do is promote it as a packaged name and standardize it. And so we have finally gotten enough people together with the Institute of Custom Compounders and all those things that we're finally starting to see some phase 3 trials. Okay? And as soon as we do that, we get good research that shows that this stuff is far superior to horse piss and Provera. Okay? But it doesn't make any difference because the gynecologists keep looking at their patients and saying, well, there's no research on that. And I go, really? There's probably 150 trials that have been done now. It was very interesting. They did a trial back in the 1980s called the HARES trial. And we were having problems with the fact that non-bioidentical hormones, Provera, was causing a lot of heart attacks. This is prior to the Women's Health Initiative trial, which proved that. And so some wise guy decided that what he was going to do was break women up into 4 groups, and a quarter of them got nothing, and a quarter of them got Premarin, and a quarter of them got Premarin with Provera, the most toxic combination on earth, and a quarter of them got Premarin with human progesterone. Okay? And they followed them. They had to stop the trial. The people in the Provera group were dying so fast, and the progesterone people were doing so well that they didn't complete the trial. And then that resulted in the PEPI trial, if I remember correctly, and the 2 of them definitively proved that progesterone was superior. That didn't affect the gynecologist. That didn't make them wake up. So then we finally got out in 1990s, I think it was. We finally forced Premarin to do some clinical trials because they've been grandfathered in since 1911, and estrogen had never been tested for safety. Only birth control pills had. Well, you can't compare the two because giving hormones to somebody who has no hormones can't be compared to giving someone more hormones when they already have their own hormones. And the purpose was to destroy your hormones, which is what birth control is about. And so we didn't have any safety studies on Premarin. So they finally got a huge trial, 5 years long, that was controls, no drug, Premarin with Provera. And they were going to follow these people for 5 years for all diseases. So we're looking at osteoporosis, Alzheimer's, heart disease, onset of diabetes, all accomplished, everything that you could imagine. 2 years into the trial, the women on Prempro were dying so fast that they stopped that phase of the trial and said we could only continue the Premarin trial because the Premarin women were doing much better than the menopausal women. Okay? And it's really interesting to this day, if you ask a gynecologist what happened in the Women's Health Initiative trial, they will claim that it proved that estrogen is dangerous. When what it proved is estrogen, even horse piss, is beneficial, and that Provera kills you. That resulted in a black box in the PDR. Provera has more black boxes, 9 of them in the PDR, than any other drug in the PDR. And they stopped the trial. They said it is too dangerous to have patients in clinical trials continue this drug when they're being looked at monthly. Well, if that's true, then you should take it off the market, right?
Right.
No. They just left it on the market, put a black box, let her go, and misinformed all the American physicians. I listened to the stuff that was said in meetings, and I was very confused, and finally I went and downloaded the raw data from the study and read it. And there were lots of interesting facts in there. People believe that hormones cause breast cancer, but the Women's Health Initiative trial effectively proved that menopause causes breast cancer. And I always tell women, I go, think about it. Talk to your friends. Are the people who are on hormones, even horse piss, getting breast cancer? No, it's the women who refuse to take hormones at menopause that are getting breast cancer. Of course, the people who are really getting breast cancer are the people who are doing annual mammograms. That's the reason why we went from 11th to 1st, is because you can't use radiation to diagnose cancer because you're going to cause cancer. We didn't even have the form of breast cancer called DCIS, the most common breast cancer now. DCIS means diffuse carcinoma in situ, meaning I turned both of your breasts into a solid massive cancer and it's everywhere. That tumor didn't even exist when I was in medical school, and now it's the most common form, because if you're going to do mammograms to both breasts, you're going to get breast cancer in both breasts all over. Nobody sees this? I mean, apparently not. It's only me.
This is horrific.
It is horrific. The whole story of the fact that this universal disease, I mean, not every woman has it. If you're overweight, one of the endocrine organs in the human body is the fat cell. We call it the adipocyte, okay? And the adipocyte makes a hormone called leptin that makes you hungry and makes you eat more and creates a cycle that leads you to diabetes. That's syndrome X. And the other thing that the adipocyte does is it makes estrogen if you have enough of it. And this is the reason why you get more osteoporosis in thin women, is because they don't have any protective estrogen. When I draw hormones on women who are ideal body weight at menopause, they usually have no hormones at all. Whereas overweight women, I usually don't need to give them estrogen. I only have to give them progesterone to balance their estrogen. And so, and there's just so much of this stuff, you could just go forever. Here's a study showing that menopause increases cardiovascular risk and causes diabetes. Yeah. And this was a study done 20 years ago that showed that the transdermal bioidentical gels and creams were safe. This is interesting. We talked briefly about DHEA. And when you make hormones, you take cholesterol and you turn it into, you take alpha-linoleic acid, you turn it into gamma-linoleic acid, and then that makes cholesterol. And then cholesterol is turned into squalene, which is the hormone in sharks, squalus. And it's the most primitive hormone, and it's not even a hormone in the human body. It's a pre-hormone. It does nothing. And then squalene turns into pregnenolone, and pregnenolone is the master hormone. It makes all other sex hormones, estrogen, progesterone, testosterone, DHEA. And that hormone is a moderator. So a lot of women who come to me and are going into menopause, all I do is put them on pregnenolone, and then they go back out of menopause. And the next time they go into menopause, they go into it abruptly instead of this climacteric dribs and drabs thing. And so, and then pregnenolone gets turned into progesterone down one arm, and if you take too much of it, cortisone. And across the other arm turns into DHEA, and then testosterone, and then testosterone is made into estrogen. And that's your synthetic pathway. And I think I have a part of that in here.
You're describing natural processes in the body.
Oh, sure. This is, all you're doing is just moving a little bit of something around. I don't know what I did. Here it is. It's going to be right behind this one. I had a really nice chart for us, and I wanted people to see this. And I may not be able to find it because we skipped. We did. I won't find it. And so my point was to get back to that DHEA. DHEA is the primary thing, along with progesterone, that causes bone to be repaired. People think estrogen is. Estrogen actually slows bone breakdown. DHEA, progesterone, testosterone cause bone growth. And so estrogen alone isn't very effective for osteoporosis, but it's helpful. DHEA which is an over-the-counter supplement that usually is garbage if you buy it at Kroger's or GNC, but if you buy it from a reliable person like your compounding pharmacist, is very, very effective. Does the same thing as cortisone. If you have lupus or rheumatoid arthritis, and the only way that you can control that disease is to take cortisone, and of course cortisone is going to cause diabetes, weight gain, osteoporosis, skin thinning, stomach ulcers, all kinds of high blood pressure. If you just use DHEA, you get the same results with no side effects, and instead you get bone increase and things are improved because this is the anti-cancer hormone. Get a rheumatologist to try that sometime. I'll bet you can. I have taken more people off of Humira or methotrexate with DHEA than you can imagine. And it works wonderfully. And of course, all these people are given cortisone, and cortisone suppresses DHEA, so now you're in a loop. Now your treatment is causing your disease.
Right.
And we have a lot of those now. In the end, we need to get back to this concept that the pituitary is the answer to knowing how you're doing. If your FSH is normal and your pituitary is healthy.
That's follicle stimulating hormone?
Correct. Okay. And if your FSH and LH, luteinizing hormone that control ovulation and estrogen formation, if those are in normal line, then you're not menopausal. And so one of the 13 studies that has been done on Alzheimer's is an Alzheimer's researcher one time was frustrated that no one was finding the cause of Alzheimer's. So he went out and he studied people as they developed Alzheimer's, and he studied what lab tests went abnormal. Okay? And guess what test correlated best with how much Alzheimer's you're going to get? FSH. Same thing for bone density, osteoporosis. You want to predict what's going on, you need to be looking at FSH. And so you can really screen people for menopause with nothing but an FSH, okay? And do it accurately. If you look at the amount of money that we're spending in America for osteoporosis, and how we're treating it, it just makes me cry. I mean, everybody's out there taking Fosamax and getting these $12,000 IVs once a year that make you have fibromyalgia and just awful, awful drugs. They're called biphosphonates, okay? And they're all terrible, and they all make you sick, and they put you in atrial fibrillation, and they eat holes through your esophagus, and they make your teeth fall out. And everybody's being given these pills for osteoporosis. And I had something happen to me about 15 years ago that is one of the things that's really jaded me. And I don't admit I don't need much help, okay? I did work for the FDA for 13 years, so I'm jaded enough, okay? But this one blew me away. This article came out in the Journal of the American Medical Association. Strontium ranelate is extremely effective in osteoporosis. This is just a trace mineral, okay? And so I read this thing and I thought, well, that's great. Somebody's going to come out with a new therapy in the next couple months because it was in the New England Journal of, Medicine. And 6 months went past and I didn't see any ads in the magazine. So I called up my custom compounder and I said, hey, what happened to strontium ranelate? I thought we'd see it on the market by now. And he said, oh, this is going to piss you off. What do you mean? He says, the Fosamax people bought the patent on it and took it off the market.
Oh my gosh.
I went, no, you've got to be kidding me. The people who have the most toxic drug are suppressing the safest drug that's ever come out. And he said, yeah. And I went, that's terrible. And he said, don't worry about it. I can't get it because it's patent protected, but I can get you strontium citrate. It's not quite as good. It doesn't dissolve in water quite as well. It's a little gritty. We'll put it in capsules so they'll never know. It'll still work. And I said, great, make me some. And oh my gosh, in the next year, I went through and put all my osteoporosis patients on it. And everybody lost 5 years of osteoporosis in 1 year. And so I've got everybody taking this stuff and it's going great. And After a couple years, it became a supplement. And I told people, oh, you can just, go buy it at your health food store, whatever. And I quit carrying it in the office because it was readily available. You could buy it from Life Extensions. And all my patients started calling me up after a couple of years, and they went, I can't find it. So I called up my custom compounding pharmacist, and I said, you got any strontium? And he says, oh, this is going to piss you off. I went, what now? He says, all of the strontium in the United States is all made from the slag from one steel mill, and they figured out that it has a medical use, so they're simply getting the strontium out of their metal and they're selling it to the pharmaceutical industry. So the Fosamax people bought the steel mill. And I went, you've got to be kidding me. So I called up my biochemist who does a lot of equine manufacturing, so he buys supplements in 1,000-pound lots. And I said, Jack, have you got any strontium? And he said, you mean extra? And I said, yeah. And he said, yeah. I said, what do you have? And he said, 44 pounds. I went, I can't do the math. It seems like a lot. And he said, yeah, it's a lot. And I said, I'm tired of getting screwed. I said, turn it all into capsules for me and send it to the office. And that was 15 years ago. I just used the last bottle of it about 2 weeks ago. Okay, so I didn't have to worry about it. But some other steel mill figured it out, and it all stopped in a couple of years. But that's how our healthcare works. It's like piracy. It's like you would call that terrorism. That's medical terrorism.
And it shakes us, to the core when everybody talks about how we live in a free country and how people are more aware now, they have more choices than ever before, and that kind of thing. And it sounds like, no, there really are these anti-human sinister forces that are out there just with a profit motive and really not working for our...
Well, but the good news is, oh my gosh, I have like 5 blogs that are really good writers, like Mercola, Dan Williams, and these guys are writing an article a day about this stuff. And so the word is getting out. They're just not as inflammatory as I am because I don't care. I'm old and I'm going to die. I'm kind of hard to intimidate now. Never anger an old man. And when we talk about osteoporosis, look at the disinformation. This study is now 10 years old. Calcium doesn't work in osteoporosis. Who would ever think that? It's right on your DEXA scan. Be sure to take 1,000 milligrams of calcium a day. The Japanese resolved that issue 20 years ago. 20 years ago, the Japanese took 1 million women, divided them into 3 groups of 333,000, and gave one group no calcium at all, and gave one group calcium pills, and gave one group calcium only in green vegetables. Okay? And the people who got no calcium at all, it had a little osteoporosis. The people who took calcium in pills had terrible osteoporosis, and the people who took calcium in green vegetables, in other words, a healthy diet, didn't get osteoporosis, separate from the issue of menopause, because the real cause of osteoporosis is lack of hormones, right? But in terms of taking that other variable out, that was where that came out. Once they saw that, they went, well, that's weird. Okay, well, what does work? So they did it over again because they noticed a subset of women in the calcium group didn't get any osteoporosis, and they were all taking magnesium. So then they went back and compared magnesium to calcium. Well, this all makes sense. When you take calcium in a pill, it goes into your bloodstream really fast, spikes really high, and elevated calcium suppresses parathyroid hormone. And parathyroid hormone is what deposits calcium into the bone. Why would the body want to put calcium in bone if it sees a lot of calcium? It would want to get rid of calcium. It would want to break down bone. Whereas magnesium tells parathyroid hormone to go up. And not only that, when you take calcium 1,000 milligrams as a pill, you lose 400 milligrams of magnesium in your urine. So all calcium is made with magnesium in it to neutralize that. The only problem is they always put in magnesium oxide, which isn't absorbed, so it's just fake. It doesn't do it at all. And so, what you want to do is take magnesium and eat your vegetables. and you do fine. Interestingly, in the middle is dairy. Dairy is halfway in between pills and leafy vegetables. It causes a little osteoporosis, not much.
So this whole push by the dairy industry of strengthen your bones and teeth by drinking milk.
And of course, the reason this study was confusing is they gave calcium with vitamin D, and of course, vitamin D is critical to osteoporosis. And I meet all these people who come in and they say, my doctor told me to take vitamin D, and I go, well, what was your vitamin D level? And they go, well, I don't know. I go, do you understand that vitamin D is toxic? If you take too much of it and get above 100, it causes osteoporosis. So you don't know what your vitamin D was before you started, and you don't know after. And they go, right. And I go, come on. We've got to get some science going here. Have we got enough time to do male hormones
Let's
today?
talk about men. Yeah,
Okay.
I promised our viewer that we would.
Yeah.
Very interested in testosterone levels and what happens. Again, getting back to your story of, well, it's natural. What's natural for testosterone levels in the aging adult male?